Can you take HCG and Gonadorelin together? So in this video, we're going to talk about how testosterone replacement therapy leads men to looking for ways of stimulating their own production of testosterone through the use of peptides like kisspectin, Gonadorelin, HCG, and clomiphene. But we're going to specifically focus in on the HCG and Gonadorelin. And do you want to actually take these at the same time? This is not medical advice. This is not Regan telling you to get on one or the other. The short answer is you want to work with a licensed provider who will help you assess if it makes clinical sense. But what I keep finding is that so many doctors, they can prescribe testosterone, but they don't really know much about HCG or Gonadorelin. And so if that's you, or if you're looking for a medical team who understands hormones, they understand peptides, go to agelessfuture.com. Get your blood labs ran. My team can help you get a very personalized peptide protocol put together that will help you achieve the way you want to look, feel, and perform no matter what age you are. Let's talk about these two molecules. So how does this work? Well, if you think about the hypothalamus, that's the executive in your brain that is sending out all of the activities to the pituitary. And so the hypothalamic pituitary gonadal axis, or HPG axis, is what we're trying to regulate because it's the brain behind the testosterone. It's really important to think about the architecture and how the body's designed, which is really beautiful. So this hypothalamus, it releases gonadotropin releasing hormone. And this is in pulses. Every 60 to 120 minutes, this pulse travels to the pituitary gland, which then stimulates by releasing luteinizing hormone, or LH if you're looking at your blood labs, and then FSH, follicle stimulating hormone. So the gonadorelin is a peptide that can activate the same response of the gonadotropin releasing hormone. And gonadotropin releasing hormone, while it goes in pulses, guess what turns it off? It's stress. And so a lot of men end up with low testosterone because their stress levels are too high. If you consider one of the studies that they did where they took men with low testosterone, and all they did is they took them into the woods to cut down trees for 2 weeks. They tested the testosterone levels before. These men camped together. They did heavy physical labor for just 14 days, and when the men came back, they came back as real men. They had doubled to triple the testosterone levels, and they felt great. So maybe dudes, if you're low on testosterone, go cut down some trees, but I don't think many of us want to do that. But the other thing you can do is when there's ways to mitigate stress, you're going to get a better pulse for testosterone. But if you are on testosterone replacement therapy, you do want to make sure that you're still getting the signal in your brain. And it's really important so that you continually receive the benefits of testosterone. So if you've gotten on testosterone and you said, man, I felt amazing for the first 3 months, 6 months, the first year, and now I don't really notice anything, it's because now your cells have become lazy. You don't take in that testosterone into the tissue because you're not making this on your own. And we're big fans of cycling off testosterone at certain periods of the year and using something like HCG or Gonadorelin or clomiphene. That seems to work really well. And most of my men, especially if you have risk of stroke, when you're on testosterone, your body's going to be pulling out lots of red blood cells, and those red blood cells can increase your hematocrit and hemoglobin, can make your blood more sticky and make you at higher risk for stroke. So make sure you're checking those markers if you are on testosterone. But here's what luteinizing and follicular stimulating hormones. So these are at the top of the brain. And luteinizing hormone, it travels down to the testes and signals your Leydig cells. And these Leydig cells make testosterone. The FSH, or the follicular stimulating hormone, works on the Sertoli cells to support sperm production. This pulse and frequency, it determines which gonadotropin is favored. Faster pulses, you're driving that LH gene transcription. Slower pulses, it's the FSH. And so testosterone replacement therapy, it suppresses this entire cascade. And so if you are on testosterone, you look at your labs and you'll see that your FSH and LH is below 0. That means you're not producing any of this on your own. And so the exogenous testosterone, if your body already has it, our body's just simply a system. It's a feedback system. And if you have what it needs, then your body stops producing it. So you'll find that when you're on testosterone replacement therapy, your intratesticular testosterone drops by up to 94%. Which over weeks to months produces testicular atrophy or small bowel syndrome, and you also have a loss of spermatogenesis. And so if you're trying to have babies, this becomes a big problem. So if you think of what gonadorelin, it acts on the pituitary. It mimics this hypothalamic pulse signal where you're stimulating luteinizing hormone and follicular stimulating hormone. The HCG, this is the human chorionic gonadotropin. It acts on the testes directly. It's a luteinizing hormone analog with a longer half-life that binds on these Leydig cell receptors and drives intratesticular testosterone production, and it bypasses the pituitary entirely. Now, HCG is harder to compound based on some of the regulations. Gonadorelin does have a shorter half-life, but does seem to have a little safer of a profile. So that seems to be the one that we've used. It also works both on the LH pathway and the FSH pathway. And so HCG, while it stimulates the testes directly, the gonadotropin releasing hormone pathway is what gonadorelin activates. So it's working on the brain. So it's keeping that whole cascade, that HPG axis, really optimized. So if you look at the pulsatile, when they looked at sperm counts, the pulsatile gonadorelin induced spermatogenesis more quickly. So if you're trying to have babies now and your lady's ready, then the gonadorelin may be the better route. The overall relates with HCG versus gonadorelin. They were very similar. So if you think about this on a provider strategy, if you want to maintain and preserve testicular size, and then also maintain that pituitary axis stimulation, you might want to use gonadorelin for that pituitary signaling, and then HCG for direct testicular support. If you're coming off TRT and you need quick testicular function and restored ability of creating your own testosterone, HCG is going to help be that kind of that downstream trigger, where gonadorelin is upstream, and you can use both of those simultaneously, especially if you're concerned with spermatogenesis. The evidence, because HCG has a little longer half-life, you may get a little greater total volume of sperm count versus gonadorelin, but gonadorelin will work a little quicker. If you think about the 1-year follow-up, you think, what's the risks? Well, if you overstimulate this axis, you can end up having very high levels of testosterone, and that testosterone can get aromatized and turned into estradiol. And estradiol, when that's elevated, that's a concern because your Leydig cells convert testosterone into estradiol, and so that can have side effects including gynecomastia or man boobs, water retention. You can have the feedback suppression. So you want to definitely monitor your estradiol. Now, we're not a big fan of getting you on estrogen blockers. It's just a matter of, why is this aromatization happening? And usually it's just adding in your cruciferous vegetables, making sure that you're getting rid of the chemicals in your body. Chemicals have such a major role in our hormone production. Just by making sure you're eating good organic foods, getting fiber in every day, using binders like some biotoxin binder or environmental toxin binders. This is the fulvic and humic acid. These short chain and medium chain binders can be insanely helpful for testosterone. And then men, make sure you're hanging out with other dudes. That will increase your testosterone levels. I can't tell you how many patients I have in their 70s, 80s, 90s, and they spend a lot of time in groups of men, and their testosterone levels stay very robust. So the Sigma male, maybe that's not the healthiest way for us to move forward in this world. There's also a great book that just got released by David Dita called The Man of Zero. Read that book. It's interesting because it will give you some insights around some of the psychology around the masculine and feminine energies, when you feel just kind of like empty. Very interesting read. For those of you who want to go deeper, I appreciate you being on this channel. Our goal is to help you feel, look, and perform your best at any age. It starts with blood labs. Get your blood labs tested to see if HCG or Gonadorelin or Kispectin or enclomiphene might be a better option than testosterone for you. Or maybe not, but my medical team will help you make that decision. And I am Regan Archibald. I'll see you on the next video.